Um, which kind of brings me to healthcare as a commodity, and we see a lot of human impacts of this that in our capitalist healthcare system go the over 50% of crowdfunding efforts are to help people with medical expenses. Medical debt is the number one cause of bankruptcy. Um, I believe it's 1 in 3 diabetics has reported on skimping, going without using less insulin than they need in the past 30 days because it's so expensive. This is the person I'm kind of hovering the cursor on is Carrie Ann Lucas, a totally badass disabled activist who died last weekend because her insurance company wouldn't authorize a medication she needed. They would only authorize a cheaper version of the medication that she had a bad reaction to. And so, yeah, I mean, there's so many human costs to our capitalist system of healthcare. And this speaks to why the Black Panthers and their survival programs focused on health were so important. The healthcare provided by the Black Panthers was so important. Why the Young Lords took over the hospital and kind of held it hostage is the wrong word because they were demanding better care. And forcing the hospital to vaccinate, provide needed vaccines to community members who couldn't afford them. So, we have a lot of medical tourism, which is what I was doing when I lived in El Paso and would go to Juarez, Mexico to get treatment for my sore throat. And we're one of the only systems countries where healthcare is tied to employment. And this originated in the 1920s um, as sort of an anti-unionizing measure and an anti-labor organizing measure. Because if you can only get healthcare if you stay in your job, you have a lot less bargaining power. We're not going to go on strike. We're not going to all quit en masse across the industry because we need care for ourselves, healthcare for ourselves and our loved ones. So there are quite a few different streams